Hi everyone, this is week 3 and the topic for discussion this week is physical exam techniques, equipment, and documentation and communication. So there's a few PowerPoint slides that we are going to go over, and let's move on. There are 4 physical assessment techniques. They include inspection, palpation, percussion, and auscultation. We're going to go over each of these techniques in detail. The order within which you apply these techniques is standard for most body systems, and you want to follow that particular order when you're performing a physical assessment. Inspection first, then palpation, then percussion, and last auscultation. However, as you will learn during an abdominal assessment, the order of these techniques does change. So for most of the body systems, it is in this order, but when you are doing an abdominal assessment, it is in a different order, and so you'll be expected to perform in that way. Inspection is the method that you can gather information just by observing the patient, so just using your eyes. And you are gathering data as soon as you look at the patient. You initially get a general assessment of what the patient looks like. Do they appear to be well or ill? Do they appear to be well nourished, in good form? Versus, do they particularly look disheveled or unkempt or unwell? And then specifically to look at specific body parts, you are going to carefully undrape the area that you need to see while providing privacy and covering the other parts of the body, so you don't look at everything at once. You take care to provide privacy for the patient. So again, with inspection, you're observing physical characteristics, getting a general assessment of health status, nutrition, and so there's a fair amount of information you can get just from your initial survey. So just when you're documenting Tina's assessment or any of the other avatars, just make sure that you're doing the same kind of inspection and getting an overall impression of the health of that person, and note any facial expressions, etc. The next technique is palpation. So you're using your hands and fingers and fingertips for this, and on Shadow Health, you'll be using virtual hands. You'll see the hands appear, but there's several assessments that you can make through touch, and you'll be doing that virtually with your avatar and then practicing that in the lab. There's levels of palpation. There's light, moderate, and deep, and this is an example of light palpation. You can see that the skin is not being indented that much. There's very light pressure being applied to the abdomen, and you would begin your assessment with light palpation and then progress to deeper palpation depending on what you are actually trying to assess. So here, the clinician is applying moderate to deep palpation. You can see that there's more pressure being applied, that the skin is further indented. You can also note that this person is wearing gloves, but again, that is, clinician dependent. I think that wearing gloves for palpation removes some of the subtle findings that you can assess without a gloved hand. Using just your fingertips, the finger pads, helps with a finer discrimination. So if there was, say, a swollen gland or lymph node, if there was a rash that had a particular texture to it, if there was edema, you're going to get more precise information by just using your fingertip, as is being demonstrated in this slide. The third technique is percussion, and I would say that percussion is probably used the least by non-advanced practice nurses. So percussion is really provides more in-depth information leading to a diagnosis. So you probably aren't going to percuss that much with your patients unless you become very specialized in a certain area of nursing. You will be percussing during your shadow health module, so I wanted to make sure I included it. And direct percussion is when you're putting your fingers directly on the patient and tapping or striking quickly, whereas indirect percussion is when you tap on your finger between you and the patient and provides a different sensation and a different level of sound and evaluation of the body system that you are assessing at that point in time. In this slide, you can see an example of indirect percussion. So the clinician is tapping with the middle finger of their right hand onto the middle finger of their left hand over an area of the abdomen. And you want to strike sort of firmly and quickly, and you'll get a sound that indicates dullness or airspace or fullness, and we can practice that in the lab. The last assessment technique is auscultation, and I'm sure you are auscultating your patients all the time. We auscultate lung sounds, heart sounds, abdominal sounds, and some advanced techniques auscultating for bruits in certain locations. But we're going to go into further detail in terms of very specific locations for heart sounds especially, and criteria for assessing lung sounds. This slide, I just wanted to include it because I've seen a lot of people put stethoscopes in backwards, and when the earpieces are directed forward, that's how you put the stethoscope in your ear and not the other way, and that's the best way for you to hear sound. So sometimes I see people putting in stethoscopes in their ears backwards, so I wanted to point that out. This is an advanced technique using an ophthalmoscope to visualize the interior eye structures. It's not routinely done by nurses except for advanced practice nurses, but it is part of your shadow health eye exam, so I just wanted to mention it. You will not be responsible for using an ophthalmoscope in lab. In addition, an ear exam with an otoscope is generally done by advanced practice nurses. Some school nurses do examine children's ears, and I imagine if you work in an ear clinic or an HEENT clinic, nurses would perform that skill. So this just points out that in order to see the eardrum, you have to maneuver the ear up and back in adults and down and back in kids under 3 to straighten the ear canal. Another advanced technique is using a tuning fork to assess the cause of hearing loss. And again, this is not done routinely. I don't even see pediatricians and nurse practitioners using a tuning fork on a regular basis. Maybe otolaryngologists do, and if you work with an otolaryngologist, you may get familiar with using that. This is something that we will be able to practice in the lab because I think it's kind of fun. So, when you're about to complete a physical assessment, you want to make sure that you think about all of the tools and equipment that you're going to need, and you want to gather that first. Just like with everything we do, we want to make sure that we have everything we need with us before we begin, because you don't want to run in and out of the room. And so we'll have an opportunity to practice gathering equipment when we practice in the lab. We'll have a table of equipment, and you'll choose what you need for that particular assessment. In our last slide, I just wanted to talk briefly about SBAR. It seems that most of you are familiar with this communication technique. It is a requirement for the focused exam modules on shadow health. And so in order for you to earn the full points, I do recommend that you watch the SBAR video that I posted in this week's course information, and also read the 2 SBAR articles that I posted, which are short and really useful, so that when you document your SBAR after your focused exams, that you do it correctly, include what is needed, and not include what's not needed, because it's as important to be concise as it is to be thorough. You want to say what you need to say in the fewest amount of words as possible, but make sure it's complete. And that's it for this week. Let me know if you have any questions or concerns.